Dr. Cheryl Wu with LaGuardia Place Pediatrics. Today we're going to talk about how to burp a newborn baby. This is baby Wilson. He just fed on one side, not on me, on mom. We're going to try to burp him. We might not get a burp out, but I'm just going to show you how to do the different ways. So if you look at a baby's stomach is right here, and the stomach tends to pouch outwards. So, and the opening of the stomach is down here, and the stomach actually goes higher than the opening of the stomach, which is the esophagus. So sometimes an air bubble can be trapped here. You kind of have to move the baby kind of around. That's why there are multiple different ways to burp a baby to get that air bubble that can be trapped up here, kind of down below, and then out through the esophagus, and then out their mouth. So the reason why we want to burp babies is because if the air gets trapped in there, it can be very uncomfortable. It can make them feel distended. The other thing is once the air goes through it's called the pyloric sphincter down to the intestines from the stomach, it becomes gas and it becomes really uncomfortable as well. So, usually babies, I'm sure everyone's heard that bottle-fed babies tend to swallow more air because there's air in the bottle. But the other thing moms and dads don't realize is when babies cry a lot, they also tend to swallow a lot of air. So just because a baby is exclusively breastfed doesn't mean that he or she doesn't need to be burped. So, if one thing you can tell if they need to be burped is they act uncomfortable, they might be hiccuping a little bit like this because the gas can irritate the diaphragm. And the other thing is they might throw their head back, meaning that something is uncomfortable inside the belly. So we're going to try to do some burping. Alright, so first, the first thing we're going to do is obviously air is going to rise to the highest point of the body. So we're going to sit the baby up, and you want to make sure you support their head like this. And you can lean them forward a little bit, okay? And you want to kind of gently pat their back, kind of like this. Rub the back a little bit, do this. Of course, there's always the standard put them on the shoulder kind of burp. I've got my burp cloth ready here. Support the head. Put them right over your shoulder. Other thing you can do too, when there's a little pressure on the chest, it just makes them feel kind of good. Look at them. I'm going to do this. Sometimes I can, there you go. Does that feel good? Okay. Another thing you can do is, again, remember that the stomach outpouching is on the right side, right? So let's imagine where the gas bubble can be. It can be stuck here, and then the opening is over here. So what you want to do is you kind of want to even lean them on the side like this, and then do this. Sometimes that works. Lean them forward a little bit more. Sometimes you can even lay him on his belly, like this. And you want to make sure you support his head, like this. Okay. And sometimes just even moving him around a little bit, you can get an air out. Obviously, I'm kind of like cycling through this pretty quickly, and some babies that tend to spit up more. If you move them around a lot, they can, milk can come out. But whatever position is most comfortable for you and for your baby, that's the one that you should stick to. And I usually say, try for 10-15 minutes afterwards. If you don't get any air out, especially if it's a breastfed baby, then it's probably okay. And that's it for today. Thank you for watching.